Laboratory activity number 5, titled Basic Urinalysis and Interpretation of Renal Homeostasis. This laboratory focuses on the physiological analysis of urine using physical examination and chemical test strip techniques. So this laboratory activity aims to examine urine samples using reagent strips to detect selected chemical components and interpret the findings in relation to renal physiology and homeostasis. First, wear proper PPEs and verify that the urine sample is correctly labeled. Observe the sample visually and record physical characteristics such as color, clarity, odor, etc. If available, measure specific gravity using a refractometer or urinometer. Otherwise, rely on dipstick estimate if the strip includes it. Remove one dipstick without touching the reagent pads and immerse it completely in the urine for 1 to 2 seconds. Withdraw the strip, gently remove excess urine, and hold the strip horizontally to prevent reagent mixing between pads. Weight the manufacturer recommended reaction times and compare each pad with the color chart promptly and under good lighting. In this case is 30 to 60 seconds. Record results for pH, specific gravity, glucose, protein, ketones, blood, leukocytes, nitrites, and other available parameters. However, in this case, only specific gravity, glucose, protein, and the pH level is available within the dipstick. Interpret each parameter by comparing it with normal values and by considering renal physiology. Dispose of used materials properly and wash hands after the activity. Summarize which findings suggest normal urine and which findings may indicate altered filtration, metabolism, hydration, or infection. The collected urine sample is clear and pale yellow in color. It is also odorless. Upon examining the results of the dipstick from the urine sample, it is indicated that the glucose level is negative, the protein level is negative, the specific gravity is at 1.025, and the pH level is at 6. Since glucose is negative within the sample of the urine, it is indicated that kidneys are healthy and are efficiently filtering and reabsorbing glucose back into the bloodstream rather than releasing it into the urine. A negative glucose result from the urine sample may also mean that your blood glucose level is within a normal and healthy range, which is usually below 160 to 180. A positive presence of glucose within the urine sample may suggest that a patient or a person has diabetes. A negative protein result in urinalysis indicates that healthy kidneys are efficiently filtering blood and keeping essential proteins such as albumin within the bloodstream. If a urine sample shows a positive result in protein, it may indicate a temporary factor like dehydration, intense exercise, or fever, or it could be a sign of long-term kidney issues, high blood, or diabetes. The specific gravity of a urine sample reflects the kidney's concentrating ability and hydration status of the person. The normal range is within 1.005 to 1.030. If the specific gravity falls below 1.005 or below the normal range, it indicates that the urine sample is diluted and that a person is overhydrated. If the specific gravity of a urine sample is above 1.030 or above the normal range, it indicates that the urine sample is concentrated and that the person is dehydrated. The pH level of a urine sample measures the acidity or alkalinity of urine. The normal range is from 4.6 to 8 with an average of 6. A high pH level that falls above 8 suggests an alkaline urine, which is common in UTIs or kidney issues. A pH level that falls below 5 in a urine sample indicates an acidic urine, which is often linked to high protein diets or acidosis. Urinalysis is a necessary and crucial diagnostic tool to evaluate the function of the kidney. It is necessary to detect early kidney damage, identify active disease processes, and monitoring chronic conditions. Urine concentration is regulated by the kidneys through the creation of a high osmolarity gradient in the medulla via the loop of Henle and adjusting water reabsorption in the collecting ducts using antidiuretic hormone or ADH. Water reabsorption is increased with high levels of ADH, which indicates dehydration, producing concentrated urine. When overhydrated, there is a low level of ADH and water reabsorption is decreased, producing a diluted urine. Finally, it is necessary to promptly test urine samples, which is ideally within 1 to 2 hours because they deteriorate rapidly at room temperature. If urine testing is delayed, bacterial proliferation is increased along with the changes in the pH level. Cell degradation is also increased alongside with its chemical instability within the urine.